Hi, I'm Jake Posey with Feather Health, and today I have Yitzhak Magoon with me, our founder. And Yitzhak, I want to talk to you about the healthcare data and how that goes from one place to the other. I hear these terms HO7 and FHIR a lot, but what can you explain to us what they mean and how they're implemented?
Yeah, so HL7 stands for Health Level 7. Essentially, it's a standard that was created back in the 80s, the late 80s, by the HL7 organization for the sole purpose of exchanging data in a standardized way between different healthcare systems. So that's essentially its sole purpose. And basically, what it is a pipe-delimited file, or pipe-delimited format rather, where in which each of the individual fields has a specific meaning, and then the contents contained within those fields, essentially express the meaning of that particular message. There's
So
obviously
like field seven in there is always going to be certain data. Field 123 is always going to be certain data and so forth. So it's not flexible as far as what you put in those.
exactly. So, for example, the PID, or the patient identifying segment, PID 5 is the patient's name, so it will always be the patient's name.
Okay. And is there just one format for HO7? Is it so when you say pipe delimited, I'm thinking, like a flat file that I could just upload to an SFTP server. Is that how I get send the information back and forth?
Well, technically, you can download a pipe delimited file and put it into a pipe delimited file, sorry, and technically you can do that. However, generally speaking, it's sent over a TCP/IP connection. So it's sent over a socket
Okay.
connection. You have to open a socket like making a phone call. Once you do that, you can send the data in streams across the network, and that needs to be
Do it.
encrypted because there's
Okay.
there's patient identifying information. So it always needs to be sent generally across a VPN.
Okay. And so, with that in mind, then, do I just send one record at a time? Can I send multiple records at a time?
You would send, well, it works in a handshake type of methodology. That's how the structure works. So in other words, you send one HL7 message, you wait for what's called an acknowledgement or a NAC to come back, and that kind of signifies that the message was received by the receiving system. And so they're
Okay.
all queued. And so if you have 10 messages that need to be sent, you'll process the first one, wait for the acknowledgement, process the second one, etc., all the way through the end.
Okay. And then, with that in mind, so you're sending that information over. Can that take care of every single scenario in healthcare?
No, not at all. It does a really good job, and it covers a lot of scenarios. Really, the biggest pro with it is that it's real-time data exchange. If you compare it to other methodologies, most electronic medical records can't support real-time data exchange outside of the scope of HL7. So pushing data
Okay.
out from a medical record to another system does a very good job. Pulling data back in also does a very good job. There are, of course, many nuances with that sort of a format. It was built specifically to be extensible, meaning you can build custom fields and formats, Z segments, and things like that. So there are a lot of organizations, Epic, Cerner, et cetera, that have built their own kind of proprietary HL7 structure. And so even with standards, it's not necessarily standards. There are a lot of things that it just simply doesn't support. Surgical data is one of the big things that is very limited in the HL7 space. And there's numerous other examples. And really, depending upon the medical record that you're talking about, there are limitations. For example, Cerner cannot support real-time medical administration messages. They don't send those messages out. So you need to get real-time medical administration out of Cerner in another way.
Okay. Now I've heard the term like HO7 engine. What's that?
Well, if you think about the architecture as a whole in terms of what you want to do and how you want to exchange data, you can have, the average hospital has anywhere from 100 to 150 different systems. And so that sort of an architecture just becomes immensely complex at scale. It's very easy to just say, I'm going to send one HL7 message to this system and one to that system. At scale, it's much different. So you may have 150 systems that want the same type of data from your registration system. Whenever there's a patient that's registered, you want to create that patient in every single system that you have. So instead of from the source system creating 150 different connections, one to each of those systems, what you do is you create a single ADT HL7 feed to an engine or a platform that sits in the middle, and then the platform that sits in the middle manages all of the connections with all of those downstream systems. So, honestly, I kind of think of it as a brain. I mean, if you think of the brain and all of the neurons that exist in the brain, the engine kind of sits in the middle and everything connects through the engine. If the engine goes down, the hospital basically goes on paper.
Okay. So then, does any systems come with that naturally, like EHRs, or do you have to build that out on your own?
Most EHRs have a archaic version of an HL7 engine, so they certainly allow you to send data out. Cerner has their open engine, open port systems. Epic has bridges, for example, and they do a good job getting the data in and the data out. But every single organization still has their own interface engine.
Okay. And so if I'm a health tech, then I have to essentially build that from scratch.
Well, health technology companies, depending upon what you're trying to do and your workflows, will potentially have an interface engine, but not always the case, right? It depends upon the size and the way in which they need to integrate data. A lot of healthcare technology companies just kind of opt to use FHIR to pull data out of the system because they don't necessarily need that data in real time. If the health technology companies need to embed an application within the medical record, they're generally going to be using a smart on FHIR technology. And so their use cases for an engine become somewhat limited. However,
Okay.
for those health technology companies that do want to support real-time data exchange, yes, they generally all have their own engine.
Okay. And you used the term integration engine in there. Is an integration engine the same thing as a HO7 engine?
Yeah, it's the same.
Okay. And then, so now the data going back and forth, that just in essentially, it sounds like it's an API. So an API, typically I'm connecting to a third party via their API and I'm sending that over. Is that what an HO7 transaction is, or is it something else?
I mean, it has a bucket of data like an API, but it is a completely different protocol. So APIs use the RESTful protocol, which is essentially what FHIR uses. HL7 is totally different. TCP/IP, it's essentially like I call you on the phone. We create a connection. There's now an active connection, and as long as that connection is open, as long as we're talking on the phone, we can hear each other. But as soon as one of us hangs up the phone, there's no more communication back and forth. That's essentially how HL7 works. So
Okay.
it really is very different.
Okay. So then it's not a webhook either.
No.
Then it's kind of its own archaic technology, I guess. Okay. So then you mentioned FHIR. Can you explain FHIR to me a little bit, please?
Well, FHIR, just like HL7, is a standard, a relatively newly created standard. Although, I mean, it started about 10 years ago, but it really hasn't started getting traction, until the last 4 or 5 years. It is still loosely supported by a lot of medical records. Many do to support, the 2016 Cures Act regulations and things like that. There are a lot of limitations, but there are a lot of pros with it as well. So, I mean, first and foremost, it is a standard. Just like HL7, it's extensible just like HL7. It transfers data back and forth, but it does it generally via JSON. You can also use XML, but it uses the RESTful protocol, so it is a true API. Now, the one thing that it really doesn't support, or rather, it's built into the standards, but most medical records don't support, is the webhook functionality, I guess, that comes with FHIR. So you can't push data out via a webhook using FHIR. And so what happens a lot of times, especially for health technology companies that need some sort of a data in real time, is they have to have a hybrid approach. So they may have like a real time ADT feed and then use FHIR to pull the rest of the data.
Okay. So let's say I need information when an appointment's created in an EHR, and then I'm going to take that information, transform it in some way, and then update information back into the EHR. how would that work with FHIR and HL7?
Well, the key is understanding what that trigger point is, and that's really going to depend upon the system that you're talking about. So if the trigger point is a user that is actually taking an action, in other words, a user that is logging into a system or something to that effect, then the data doesn't necessarily need to be in real time. It's more just in time. So in other words, when the user logs into the external scheduling application, in this case, when they log in and they click the buttons that they need to, the data is then pulled from the system. And if that is your use case, then using FHIR is completely acceptable. However, if you need something completely different, if you need the scheduling data, the appointment bookings and cancellations and modifications in real time to trigger action in your system for notifications or a number of other things, that's only going to be possible via HL7. And then you need a hybrid type approach where in which you use the scheduling messages, the HL7 SIU messages, to not only post the appointments in your system, but then trigger additional actions like pulling additional clinical data on the patient.
Okay. All right. So at that point, then you're going to use kind of a combination of those.
Yep.
Okay. All right. So, so I assume then all the HRs you should be supporting HL7 and FHIR, and that encompasses everything. They don't need to have any other third-party APIs or anything like that. Is that correct?
No, that's not. Unfortunately, that it doesn't exist like that. Now, obviously, the big ones, the Cerner, the Epics, all scripts, and there's what 400, 500, 600 different EHRs. Some of the small ones, they definitely do not support all of that. And then really, some organizations, they only support what they actually have to support. So, for example, eClinicalWorks, you can pull data out of eClinicalWorks using FHIR, but you can't write data back using FHIR. You have to use HL7. So each medical record is nuanced and it's different in the way that it supports these formats. And a lot of electronic medical records, they're not they don't want FHIR. They do, but they don't, because a lot of them will have their own private APIs. eClinicalWorks has their own private APIs. All scripts, they have their own private APIs. And because Epic even, they have their own private APIs. And they've turned, each of those companies have turned those into a marketplace where in which if you're a third-party vendor and you want to do something specific in Epic, you have to pay. Right? So the medical record is getting revenue by offering these services. However, with FHIR, you can't charge. And so there are a lot of limitations from a medical record perspective in terms of what is supportable, because there's no vested interest for the medical record companies to support it other than just to meet the minimum requirements.
Okay. Sounds very complicated. How long have you been doing this?
I've been in the integration space for upwards of 12 years now.
Okay. And has it really changed to your liking since then, or has it kind of stayed the same?
Well, I mean, in the healthcare industry, it's a very slow-moving ship. It's one of those, it's one of those organizations that really does not move very fast. And health and technology, that kind of coincide, and it's almost like technology is pulling health to speed up and to get out of the Stone Age. FHIR is definitely a win. I think it definitely sets us in the right direction. I think we have a long way to go, though.
Okay. So the Feather Health system, where we're a workflow tool and integration engine kind of mashed together to provide the best of both worlds to help organizations move quicker. How can a system like Feather Health help a health tech company or a hospital whenever it comes to these different connections?
So first and foremost, to really be successful in integration, you need to understand it. You need to understand HL7, what you need, how to support it, and you need the same with FHIR. And just like I was describing earlier, these languages are extensible, meaning that even though the standard FHIR or the standard HL7 format exists, each of the medical records out there exists differently. So the data coming out, or the structure, is still slightly nuanced, which essentially means that if you're a health technology company, you're likely paying $100,000 to $300,000 annually in engineering costs just to be able to build and support all the integrations that you need. And then furthermore, if you're using HL7, You have to use an engine, most likely, and you have to have a 24/7, 365 support team managing that to ensure that the connections, stay open, the phone lines stay open. So there's a huge cost to these organizations that they're spending all of this money on integration when they should be able to be taking the money and actually building their core product. So it's really taking away the value that they're able to bring to their organizations, and it's generally always a sticking point when you're trying to get into an organization. The very first question that the company is going to ask is, "Oh, have you ever done this with Epic before? Have you ever done this with Cerner before?" And if you are not to that point, it's very difficult to convince the health system that you know what you're doing, especially if you've never worked with the structure before. And I've seen many instances where companies have signed contracts and they've started moving forward to the implementation process just for the health system to cut the contract right there because they realize that the organization doesn't know what they're doing.
Okay.
In addition to that, it takes a lot of development work and it takes a lot of time to integrate. And so one of the things that we do with the Feather platform is we built out a lot of pre-built connections. So if you want to connect to Cerner or you want to connect to Epic without writing a single line of code, I think there's 12 clicks involved. You can hit the patient resource and search for a patient, or you can post a result in the system right then and there. It makes it very easy, very quick to do that, and you don't necessarily need an engineer actually doing the integration. If you have a business analyst that understands the workflow very well, they're already in a better situated position to make sure that the workflow that you're implementing is accurately done. And if a user like that can use a system and we can extrapolate all of the technical pieces, then you can just move much faster as an organization.
Excellent. All right, that's all the time we have today. I want to thank you for joining me. And for our viewers out there, if you have any questions about HL7 or FHIR and how your system needs to interact with those, please reach out to us. We're always happy to help teach you and help make sure that you're moving towards your goals. Thank you very much.
Thank you.